Thanks for joining us this morning. We thought it would be helpful to just go over nutrition and mental health. I'm here today with Laura Porter. She is a licensed professional counselor and a nutrition therapy practitioner training, as well as NCC, meaning nationally certified counselor, and that she passed a big test, which is super awesome.
It's a big deal. It just helps that, if I move away, that a lot of states require the NCC test to be passed, so it's kind of reciprocity for changing licensure. So
that makes sense. Cool. So yeah, we'll dive into some basics, and then get into a bit of specifics toward the end, and we'll answer any questions at the end.
All right, so whenever I do this presentation, I like to start with these statistics. These are the most recent ones compiled in 2017. These were the age groups, kind of the breakdown of the number of people who have been prescribed any sort of psychotropic medication. So that would cover ADD, ADHD, depression, anxiety, etc. So, usually when I put this slide up, I kind of just pause and I just ask the group, what's the most alarming thing that you see on here? And overwhelmingly, people go, there's 125,000 babies on something. Like, how is that even possible? They don't have words. How do you know they're depressed? How do you know they're anxious? What's going on? Right. And even up to a 5-year-old, they just don't have the vocabulary, the developmental skills to explain, what's going on. So, it's over 500,000.
It's fascinating that we, and as a physician taking care of all those ages, it's fascinating to me, the more that I really actually slow down and think about it, how we start to infer that maybe they're sad, or maybe they're anxious. It's really interesting, and it just really makes you wonder. We're also as physicians, certainly, and I don't know, I haven't been in training for I don't know, over 20 years, but we get trained, really, it's our training is kind of driven by pharmaceutical companies and that kind of stuff. So it's really fascinating that we're trained to think maybe that child's depressed, and that or maybe they're anxious, and I can think of myself saying that years ago, and now sitting here literally this morning reflecting on this, it's just another one of those things that makes me just kind of go, wow, what are we doing? Because if the reality is that there's 622,000 children in 2017, the number's got to be higher, that were unmet.
Right. Mm-hmm.
Wow.
And just, I don't have the specific list of medications, but they were to treat these diagnoses.
Wow.
So, and it's tough to look at. I do know one thing, though, I not included in these statistics, was that if a child is in a state custody or Child Protective Services is involved, they are 13, or foster care even, they're 13 times more likely to be prescribed a medication. So I would imagine that a lot of these kids, 0 to 5, might be part of that statistic, because it just doesn't seem like the average family doctor would be doing this.
Right.
It's hard to say, so I don't want to make that correlation, but I do know that is another statistic. And then you see, it kind of tapers, kind of the 6 to 24 years age, there's a couple million people, and then there's a big jump from 25 to 44 years. And I don't know if that's the midlife crisis. And then the 65 plus is a high number.
Living.
That's adulting right there.
It's adulting, yeah.
The 65 plus, though, we do know as people age, and they can no longer physically do the things that they've been doing, take care of themselves, live independently. That can be quite depressing for them, and so there is sometimes an increase there with antidepressants for the elderly. So anyway, it's just kind of just information. These are just numbers, but I don't think very many people are aware of how much prescribing
it's pervasive, really.
So this is kind of where I geek out on food knowledge, is just, we haven't had modern medicine for very long, and yet we've survived thousands and thousands of years and thrived. You know, I mean, obviously, life wasn't easy or hard. Like life wasn't hard, but you know, and now there's this big push back into, well, what did these tribes? How did they heal themselves? How did they, you know, how did they survive for so long, and in such a healthy manner? You know, and so the only medicine that we had was food.
Right.
And you know, nowadays it's like there's technology is amazing, and Western medicine's amazing too. It saves lives, right?
Sure.
There's a time and a place for everything. But you know, when we're talking about food consumption, and that's something that we all have to do every day, is eat. The amount of chemical exposure and you know, the quality of the food that's being grown in terms of organics or the pesticides,
Right,
all that
right.
stuff that's has become part of our physiology at this point. And now we're seeing these long-term, you know, chronic diseases, you know, the diabetes, the hypertension, and then mental health challenges as well. You know, we're stagnant. Our kids are on phones. I mean, I'm on my phones too much. And, you know, and in my opinion, I think that we're so far removed from the core of our human being that we're, you know, we are an over-medicated and over-diagnosed society. We're a quick fix. Give me a pill. I don't have time to go for a walk and lose a couple pounds, which would solve any number of problems
Right.
for certain people. And it's, you know, we're just not in that mode.
Right. No, I totally agree. Like, and I was just thinking as you were talking about, like, you know, how your ancestral, you know, like how did they survive? You know, part of it too is when we start to look at our stress response for things too. Like, I mean, their stress then was, you know, maybe for some of them was really actually being chased by the tiger.
Survival. Yeah.
And it was survival. And so your stress went up, and then when you're safe, it went down. Like it did. And
Right.
like for us, we're always like flirting in this area up here of chronic stress. And some, you know, some of us are better, and some of us are better at times than other times in terms of that resiliency. Like, can you sustain that stress? Can you mount the stress response? Can you dissipate that stress response and go back to normal? And that plays in food, in processed forms, that kind of stuff. That literally is adding stress.
Yeah,
Also,
the chronic inflammation that we have in our bodies. You know, like you said, our limbic system, it was the first part of our brain to develop in the womb. It's kept us alive for a long time.
Yeah.
However, we also developed over time a very complex frontal lobe, which is the thinking, reasoning part of our brain that would, once the danger was gone, take over and go, okay, thank you, limbic system, we're good, all clear.
Right.
But people sit in their offices, in their homes, with their, like, all pistons are firing, and there's no danger.
Right.
You know, it's like these, and we have a lot of social, and we create a lot of our own social problems as well. But we're just, for whatever reason, either we don't know how to turn it off, or we're unable to.
Right.
So, especially, I'm seeing that more and more with kids. I mean, they just cannot calm down, and there's just,
It's phones.
it's phones. It's this constant
Yeah.
feedback that we get
Right.
all the time. So yeah, my thing is like, let your kid be bored.
Yeah.
Being bored is good.
Yes, it
Go
is.
outside. So yeah, food has always been there. So there's kind of the big five. Oh, it's noon in Palmer. That's how we know. So these are the main brain chemistry, the way our nerve cells communicate with our body. There's neurotransmitters, so those are the big five. Now, these are chemicals, they're different, and they each need their own recipe in order to be created, and a lot of that comes from what we eat. And so if there are nutritional deficiencies or another chemical, a natural chemical that's present in our body, can also prevent these guys from communicating properly.
Right.
And so it might be deficiency, might be some other chemical exposure, and you know, so that's kind of where just breaking it down simply is like, let's just start with like what our body needs nutritionally to make these, you know.
Right.
So focus on that. But like you said, I mean, everything else is responsible too. We've got chemical, what's our activity level? Are we healthy? Are we in healthy relationships? What's causing our stress? What's causing our inflammation? So it's not just this, everybody looks for that like silver bullet, like this is going to be the solution to everything, and everything is so complex, and I wish it were simple, but it's like, it's everything. It is truly our lifestyle.
Right. And I think in medicine we have, and even sometimes I'll call it green pharmacy, if you will, like if you see somebody who's just all about supplements too, like, it's never just one thing. It's not just your methylation defect. It's not just your this or that. It really is like, I mean, we're all like little chemistry experiments. We're all our own bag of stuff. Whether it's chemistry, it's nutrition, and which is why we all need different things too. We all need different amounts of stress. We all need different amounts of exercise to balance us, like food. Like it's chemistry, and that's part of it that's really cool because we can actually impact a lot of that.
It's fun, and just even in my office when people come in with the same symptoms, there's a different solution for every person, right? And the best solution is usually the one that the client has for themselves, because they're more likely to follow it.
Right,
So
absolutely.
that's the beauty of that. So again, like we just talked about, diet, exercise, what we put in and on our body is very, very important for these neurotransmitters to be properly developed and let our body use them the way that they were naturally intended. So, okay. And here's the specifics. These are the big five and what they do. So, and you had mentioned something about dopamine.
Like maybe go back. I think we like we were talking before we started this. We were talking about shortages of nutrients and that kind of stuff. And I was talking about like literally a little 3-page blurb that I found from the Amen Clinic earlier this week or so, but it talked about 3 different drug classes. And so we have to think about how, it's whatever we put in our mouth that can impact us. But number one, people with heartburn and reflux, protein pump inhibitors, they deplete B12. They can impact also, iron absorption, like different nutrient absorption, because it decreases the acidity in our stomach, and how there's definitely a link between depression, memory issues, dementia down the road, fatigue. Another interesting one, and this was really not a connection that I'd made previously, is like thinking about how antibiotics impact our gut microbiome. That wasn't my new revelation this week. That one we know, and I think most of us are very aware of that. But what really was fascinating is in this little article that I found, they referred to this 2016 study with mice, and how they were able to see actually when this gut microbiome changed, it changed white blood cells in a sense, but it also stopped growth of new cells in the hippocampal region of our brain. And that is like really, really important for making memory. And so really fascinating to know, like, wow, antibiotics can impact our memory, and that's something I need to look at more.
Well, and you think about it, like, we develop memory when we learn something, so that this is impacting learning.
Right.
Really. And so you think, how many times you always hear about now, it's like, okay, doc, and I've been to multiple clinics where there is a very conscious effort to make sure that if we're prescribing an antibiotic, it is truly in fact a bacterial infection, not just a virus. Right. And I think that's becoming more mainstream. Especially for kids.
It is, but there's still the, like, I don't have time to be sick.
I want a pill
thing
anyway.
out there, and antibiotics they don't treat your viral infection.
Right.
And more often than not, when the question is like, well, I went to urgent care and got an antibiotic, and I'm like, well, did the antibiotic help? Was it 2 days later that helped? Like, we don't know. Right. Maybe you just started getting better, and that coincides with when you started the antibiotic. Like, it's always hard. And we don't have an objective measure to go like, oh, that's bacterial. Mm-hmm. Not for all things. Some things we have a little bit more objective, but a lot of, especially the upper respiratory thing, which tends to be the issue we don't have.
Yeah.
And then the other thing that Laura and I we were talking about before we were starting the presentation here is the impact of oral contraceptives, which are used by, men, like tons of young ladies, and even, I guess, well, you're all young, whatever. Like most of them are your reproductive age. But how oral contraceptives impact and deplete B vitamins. They can impact like our zinc, some of our other minerals, and as well as some amino acid absorption. And there's been a lot more press recently about depression with oral contraceptives. And another thing that I hadn't thought as much of is it actually is impacting our dopamine production, which is one of those neurotransmitters, and also impacting and playing a role in substance use disorders, which is really interesting because, like we talked about, like a lot of people get put on oral contraceptives for acne. A lot of people do at puberty. So you just have to wonder, and then they go off to college. Like
next thing you know, you're on them for 20 years.
Right.
Yeah.
And like, what are we setting people up for? And I don't even know. You can start to postulate then, like, wow, how does that impact postpartum depression? Like, is there a retrospective study? It'd be really interesting to see, like, how many people that end up like with postpartum depression or depression later in life, like how many people were on oral contraceptives when they're younger? Maybe there has been a study, I guess.
Yeah,
I'm usually thinking on the fly, so it just makes me think like, wow, I wonder if that's been studied retrospectively.
Right, and I think that, the one thing that people focus on, especially with oral contraceptives for women, is like, well, it lowers your breast cancer or increases your breast cancer risk, but then uterine cancer goes down, or one of them.
I think ovarian, and I think that probably the drug company will tell you that it's not going to increase your risk of anything else, but I'm not sure that I trust in that, in terms of breast or uterine, but apparently, and I haven't looked at this literature in a long time, but it was like it would decrease your ovarian cancer risk. But I would never ever look at contraceptives at this point. Like, we're not doing it to like for mitigating whatever risks of things like that. I mean, this is about, what I'd hope it really is about contraception, and maybe sometime in the near future we'll actually be able to use bioidenticals, which would be even better than the synthetic. And I think the problem with these things is synthetic compounds too.
Wow. Yeah. So right there we have antibiotics, oral contraceptives that we know block nutrient absorption or prevent the correct levels of neurotransmitters being created. So yeah, it's kind of scary actually. It's kind of like, oh man.
I'd say much less like any prescription drugs. There's a website that I will go to sometimes called Mytavin, mytavin.com, and you can actually go to Mytavin and you can put in medications, prescription medications. Not all of them are in there, but a lot are. You can put in a bunch of meds and then just click calculate, whatever, go, and it will produce like the nutrient deficiencies associated with those meds. It's fascinating. And so I'll do that sometimes with patients where we'll kind of go like, okay, wait a minute, what's this doing? Everything we put in our bodies, we talk about, when we talk about drugs, we try to say like, oh, well, this is our desired effect, but these are side effects.
And then we treat the side effect with another pill.
Right. And I would just kind of say like the whole idea of like side effect, like they're just effects. And we're all affected differently. But I think more it's just being aware, like, wow, like these things can deplete things.
Yep.
And things that seem innocuous deplete things.
Right. And and to me, if you're depleted of that many nutrients, our body's response is to stimulate hunger, because it's like we need stuff. You're hungry. It's not specifying exactly what you should eat. You just know you're hungry, and if that's our body's way of saying like, I'm craving this, I need this.
That's
and if you're not eating and you can go eat some hamburger or whatever, fast food satiates for a while, and your body kind of calms down, but it's still not getting what it needs, and then it's still going to trigger hunger.
Right. That's a super good point to say, because like certainly a whole bunch of us are running around nutritionally deficient. And it's really fascinating when you do actually really start to like concentrate on nutrient density of food. You don't eat as much.
That's where cravings come from. And I think that kind of leads into a little bit of that, on this contraceptive study, like why are there substance use disorders now with these women who've been on oral contraceptives for 20 years,
Right. Nutritional deficiency.
Maybe nutritional deficiency, but you're craving anything to fill that void.
Right.
And then if you're that far along with a substance use problem, I mean, that drug has taken over those neurotransmitters now, and
Right.
it's just a very vicious cycle.
Right.
So, food. Okay, so
neurotransmitters.
yeah. So these are the big five, I guess you could say, and what they do and what their purposes are. So, any and all of these can be affected by a lack of nutrition or other chemicals interfering with their production. So I think that's some stuff that we've known for a long time. So we'll kind of move on. So I think the big thing is those B vitamins, and Julie, you can probably speak to this, this is kind of a big one. B6, it's a necessary cofactor to make all of these mood producing neurotransmitters. So and I'm not going to I will pick on vegans a little bit, but most vegans, if that's their choice to do that, or if there's a medical reason why they're doing that, it's incredibly hard to get B vitamins because the best sources really are animal products. So most of those folks are pretty savvy on supplementing.
Right.
But if you're lacking B6 in particular, I mean, some of the deficiency symptoms are listed there, and these are the things that I see in my office.
Right. And
I
would say similar.
Mm-hmm.
I see this a lot in kind of PMS kind of symptoms too. A lot of times can be really people can a lot of times get benefit, which you actually have premenstrual tension, and their B6 can be real helpful.
Mm-hmm. So that's kind of one of the really important cofactor ones. So this, I'm breaking every PowerPoint rule here with so many words on here, but it's really hard to condense this into one slide. And in epigenetics, if you are not familiar with that, and Jill, you can probably speak to this much more better than I could, but this was a study, I believe, in the 60s, and it was just really incredible to see, like we were just talking about, what are these long-term multi-generational effects. And so again, these were with cats, and basically the study, and there's a great YouTube video on this as well. Dr. Pottinger took three different groups and said, okay, I'm going to put these cats on this full fat raw diet, tons of nutrients. Here's one group, and then he kind of did a middle of the road, some cooked meat, some pasteurized processed foods, and then he had another group for completely processed foods. And so then he bred the cats, and these are the outcomes. Basically, was that the cats, their physiology changed. So he was measuring their bone structures and their teeth, where the teeth are in the mouth, and so he was finding like they have smaller heads. Some of them became completely infertile. They're exhausted all the time. They would just sit around and kind of cry and moan like for no apparent reason. And then some of the behavioral outcomes are fascinating, is that the females became more aggressive, the males became docile and had little interest in mating, and they kind of walked around kind of distraught, and so anyway, epigenetics is really just, the ability of our body to switch on and off genes when we're sick or when we're well. And now he did attempt to reverse this. So in the 3 generations it took down, that he went down, these are the outcomes. It took him almost twice as long to get those unhealthy cats back to a fully functioning, physiologically healthy cat. And so it's like, if we're 3 generations in on antibiotics and oral contraceptions and antipsychotic medications, what is it doing to us? What is it doing to our unborn? And how do we reverse that? Is kind of the big thing. Dr. Terry Walls is very much into epigenetic heritage, and talking about, you know, the human side of things. And so she has a book out and some
Right.
great YouTube videos.
And some of you guys might be familiar with Terry Walls. She's actually a colleague that I met years ago through the Institute for Functional Medicine. And Terry's got she's got a couple really great YouTube videos, but she literally was wheelchair bound in what's called basically an anti-gravity wheelchair because she was so immobile with MS. And she tried all the meds. She tried everything that you know, conventional medicine or Western medicine had to offer, and she was basically in this anti-gravitation wheelchair. And literally through diet, research, looking at mitochondrial function, she's like walking, riding a bike, presenting. The other really cool thing is she's an internist, and she's worked at the VA, I think in Des Moines, for years. And so some of her colleagues have kind of been like, well, that's not possible, you know, like, so they've been seeing it all along, which is so cool. And now Dr. Walls, she's leading research showing that how nutrition impacts this stuff. And it's super cool because she still works for the VA. So it's so neat that she has stuck it out and like fought all the constraints that get put on you in, number one, in conventional medicine, but like, man, even in like government controlled VA settings. So she's just doing like epic things and talking about epigenetics. And so it's really cool. And so I think it just says, you know, what we feed ourselves and choices we make with what's at the end of our fork really makes a big difference for each of us. It also is going to make a difference for offspring.
Right.
And some of us are fighting battles because maybe, you know, if our grandparents were part of the Depression, you know, different things, like some of those things are passed down. And so, you know, I mean, I think Laura and I would agree, like, we just want to empower people because we got to start breaking this cycle. And if it's us, because we're learning now, like, we can get after it now, which is so cool.
Right. Well, and I think the egg that you and I came from was almost fully developed while our grandmother was pregnant with our mother.
Right.
So whatever was happening to grandma when she's pregnant, we were affected by that. And that, I mean, if you draw that out, it kind of blows your mind, you know, and we're the outcome of that. So these are just some more stats. You know, our brain is pretty insignificant in terms of mass in our body, but it really does consume about 20% of what we eat. So in having it is mostly fat. It's actually made of fat. And especially for women, I think we're kind of the canary in the coal mine. You know, our physiology is a little bit more quicker than men. Processed foods and things affect us more and sometimes more quickly than men. And so in this one in particular, the stat about kids, I think this was from Norway. They did a thing where they had the kids eat no processed foods, all organic. And they, after 6 weeks, a month and a half, those kids no longer met the diagnostic criteria for ADD just by changing their diet.
Yeah.
And the thing, I mean, and the other side of you know, the big purple book that I have, the DSM-5, that DSM-5 came out a couple years ago, the new one, and one of the critiques of that was that they actually made the diagnostic criteria easier so that more kids would be showing these behaviors and being able to be diagnosed. So that was one of the critiques of the DSM-5 was like, hey, now if more kids can get diagnosed, then you know, there's still that push for medication and Ritalin and those kind of things. It just made it much easier to get more of them, I guess.
So one thing that I guess one way that I think that has been tried to be spun more positively about that loosening of criteria, which I really don't even know what to make of it. But if we have all these diagnoses and the way medicine is right now in our sick care system, if you have a diagnosis, we can help you. Because if you don't have a diagnosis, well, there's nothing we can do for you, in theory. So, like, one thing that the proponents of loosening criteria would say like, well, if we can diagnose these kids, now we can
capture more of them.
We can capture more of them and we can help them. But yeah, the question is like, how do we define helping? Medication. Yeah. If we could help them all, boy, with resiliency training and nutrition and all of those things like that.
Exercise.
Yeah. Exercise, being outside.
Yeah. So, and I agree with you. It's kind of like, well, it's kind of a double-edged sword, right? If we loosen these diagnostic criteria. So, but yeah, and the problem right now, I think, is that the go-to for ADD, ADHD is medication. Yeah. And so, and the thing about that is, and I get kids all the time, they're on this medication, and in my training, it was if a child is put on a medication, that it is considered unethical to not have concurrent office visits. But a lot of times they have their appointment, they pop in, yeah, I'm doing great, they get their new prescription for the month and they leave. There's no actual therapy going into it. But now I'm starting to see a trend towards that. Like, no, we really don't want you on this medication. Let's actually look at your lifestyle. So hopefully that changes.
Yeah.
So, I mean, this is nutrition, at least for adults. I mean, you have much more control. We have the means to control, what we put in and on our body. And, unfortunately, and this is something that we make time for every day. Most people make time to eat. We all do it. So, and it is definitely a very easy modifiable factor in our life that we can and our kids as well. So specifically, we do know that what Julie, you were talking about earlier with the gut health, taking certain medications can actually block nutrient absorption. So assuming all things being equal, you're not on any sort of medication, you can still see symptoms of depression when you do not have the proper nutrients. So, those are a list of some nutritional causes right there. I think probably the big, everybody talks about gluten, it's like, what's your gluten tolerance? I actually got sick going down to Auckland. I absent-mindedly, after a 9-hour plane ride, they gave out those little chocolate-covered macadamia nuts. Oh, yeah. I cannot eat macadamia nuts. I just ate it. 30 minutes later, I'm on the floor in a bathroom at the Auckland airport, doubled over, thinking I'm going to die because this hurts so bad. And I was like, oh yeah, I can't eat those. Everybody has different food sensitivities and different food tolerances, and that's what makes us all unique. So certainly, especially up here too, with the seasonal affective issues that we have with winter and the lack of sunlight and daylight. Most, I think up here, I don't prescribe vitamin D, but I think it's one of those supplement Jill does, and it's like, it's pretty hard to OD on. Yeah, I mean, we can check levels, and we could. Yeah, but the vast majority of the time, it's rare for me. It's pretty rare for me to find people with too high up levels of vitamin D. Right. Happens once in a while, but not very often. But it's the importance too for getting, I would say, of all these things, it's the nutrient dense, organic foods as we can. Use your Dirty Dozen app that gives you that Clean 15, Clean 15 and the Dirty Dozen. And vitamin D, and man, unless you really, really don't like fish or you're allergic to it, eat salmon up here. We have access to, I think, still theoretically pretty clean fish. Not farmed. Yeah, it's not farmed, but until we find out if there's really a radioactivity problem or something. But really, I think the dose, you have to eat a lot of fish, but getting those omega-6s, from nuts, omega-3s from our fish, it's super important. Yeah, and the lithium thing, that was interesting. I watched a documentary last night called Jacob. Have you seen that? Mm-hmm. Oh, it's on Amazon. It's really interesting. But there was a clip about a town considering putting lithium in the water, so that it would, this town wouldn't have maybe so many depressed people. And I was like, well, were they talking low dose or? I have to watch it again. Yeah, right. Maybe I shouldn't have brought that up, but it was like, cool. I'm gonna have to rewatch that because I find out what town. I thought it was in Texas, maybe. I'd be depressed if I was in Texas. Me too. But anyway, the whole point is, whole foods as much as possible. And if you do buy packaged foods, I heard someone say, if there are more than 4 ingredients, walk away.
Yeah.
You know,
Yeah, I tell people 5.
Yeah,
Yeah.
4 or 5. Yeah.
Or if you don't know what the ingredients are, like
You can't pronounce them.
right, probably a good thing to get rid of.
Yep. So, and same with anxiety. I probably see this more in my office than any sort of depression. But the thing about depression and anxiety is that they're so braided together that people can't even, I'll even ask them, you know, they're like, well, I'm depressed and I'm anxious. I'm like, well, which one do you want to work on first? And
It's both.
and they're like, well, I don't even know. I mean, it's just kind of like, there's just so much going on. You know, so typically from a nutritional and a physiological side, if you are deficient in some of those vitamins and minerals there on the left of the screen, it can kind of make you a little jittery and unstable and not be able to calm down. Now, I do have some friends who are very, they're not medicated for ADD or ADHD, but they're like, you know, coffee and caffeine calms them down. You know, for another person, they're kind of like, oh man, I've been awake for 3 days and I can't sleep. But in general, I think, you know, everything in moderation, you know, coffee, caffeine, tea, sugar.
Right, and I think it's
okay.
It's awareness how you respond. Like when you think about when we do treat people with ADD and ADHD, if we medicate them, like we're literally putting them on speed, and so it is that stimulus that then ends up slowing them down, which is where, like for some people, that would be that caffeine or that sugar. But it really takes awareness on all of our parts, because one thing for one person is going to be different for somebody else. So
yeah, and you know, and I always push you know, my own friends and family to be like, no, you need to understand that there's like for beef example, if you're a meat eater, there's a big difference between grass-fed and grain-finished, or grass-fed and grass-finished, and in the actual quality of meat, what's in the meat, the nutrient density of the meat is so much different. And the taste for me, I can tell if my steak had grain. Like I can taste the difference.
Right.
So and of course eating fish, and like you mentioned earlier, you know, it's just you get so many of those omega-3s and the right ratio of the 3s and 6 and the 9.
Yeah.
As well. You know, and I a lot of my family are very fiscally conservative, and so they're like, oh, but this meat was on sale, you know, and like, look, you can buy organic, you can pay for organic now, or you can pay for cancer later. Like that's how I look at it in my head. At the end of the day, it's like you do a little investment now, and this should pay off for you in terms of health.
Right.
ADD, ADHD. You know, just again, it depends on the person, depends on the kid. I have a lot of friends who have their child might be on the spectrum, and they swear by eliminating dairy and that their child's behaviors change significantly. Avoiding those food colors and dyes, you know, those are just chemicals, and they are messing with those neurotransmitters, and then the outcome of that is the child's behavior. There's so much stuff added to our foods. The MSG, the nitrates, you know, soy isn't the pure thing that, you know, soy can mimic as estrogen.
Yep.
And so,
yeah,
you
it's
know,
phytoestrogen.
Yeah, it's phytoestrogen. So, you know, it's just fascinating. You know, I always tell when I do this presentation and people kind of ask some questions about this, I'm like, you know, in actually New Zealand, these farmers figured out that their lambs, or the sheep, female sheep ewes, I guess, weren't getting pregnant when they were on fields full of clover. And they're like, so like,
wild clover.
Right. So they're like, oh, that's kind of like a natural, you know, contraceptive. And then in Africa, there are tribes that they would have the women eat a lot of, almost like a sweet potato, like a tuber.
Yep.
And they would consume those. And because of those phytoestrogen mimicking chemicals, that was kind of like this natural birth control. It's like, so don't tell me food doesn't affect all this stuff, you know. So you have all these man-made chemicals, which, you know, on one hand is pretty, our technology is amazing, and shelf life had its time and its purpose, you know, and it's in the way we ship food, it's really amazing.
Yeah.
But again, these are not healthy things for us.
Right. We just have to be aware.
Have to be aware. And so, you know, just some things, especially for kids, you know, having maybe a higher protein snack in the morning. My story about when I was interning at one of the local elementary schools, kids walk off the bus and they walked through and they grabbed their 1% milk and orange, this like waffle thing with syrup. This was the school lunch breakfast or school breakfast. And I actually sat there and I looked at all the packaging, and if the kid ate everything, including the milk, there was like 45 grams of sugar.
Awesome.
Right first thing in the morning, right off the bus. And they go to the behavior room, and it's a big, we're going to have a good day. They send them out to their regular ed classes, and then next thing you know, they're back 45 minutes later, crashed, angry, crying. And I'm like, oh my gosh, we just set them up for failure. Like, holy smokes. So anyway, obviously bottom line, or what we're preaching here over and over again, is just the more natural and, high protein if you can do it, and iron, just real food.
Right. And I think we talk about, like, I'm certainly talking about with everybody, how the importance of protein with meals, and from a blood sugar stabilization, it's just that, like with kids, and it's for all of us to prevent crashing. Like, we all know what that is. Like, we know how to do it, but we also know how not to do it. So yeah, I think it is, it's just making sure that we're eating some balance, and really limiting, not just for kids, but really for all of us, really watching all of those things that are in processed and packaged foods. So the more that we can eat whole foods, then, no banana has a label. There's a reason, it does,
Yep. And I raise my own chickens, and I control what they eat, and they can be out and they can free range and all this stuff. And if you've ever had a farm fresh egg or a store-bought egg, I can't even eat store-bought eggs. It's just gross. They're just watery, no taste. And then, of course, I know how those chickens are treated.
Right.
So it's just like, I just can't do it. But I think everyone should get chickens.
Yeah. Right.
They're fun little creatures. And I think we've already talked about these, Jill, is the other considerations, our lifestyle. Do we have food allergies? And also your age, as we age, we process things differently. Also ACEs, adverse childhood experiences. What did you experience as a child trauma-wise that is affecting you today and affecting the decisions that you make today?
Right.
I know if I get 2 days of not very good sleep, my food choices and, some of the things that I do or decide not to do go right out the window. My willpower is shot.
Yeah.
And so, the other thing too is a lot of people, you get these like not buzzword things, but like buzz foods is like, these superfoods.
Right.
Like, I'm going to eat, hemp seed, and I'm going to add this to my diet. And I'm also like, kind of like, okay, if you're not digesting properly, it doesn't matter what you eat, your body's not going to be able to process it because your digestion is just, you have too much inflammation. So, you kind of have to focus on like, I need to heal my gut first. And then you can really start to benefit from healthy eating.
Right. It's kind of like supplementing.
Mm-hmm.
You can't supplement, you can't exercise, you can't supplement or exercise out of a bad diet.
Right.
Like you can't at all. And then I kind of chuckle at myself most of the time because I'm not a very good water drinker.
Oh, I'm terrible.
Like every once in a while I'm like, okay, wait a minute, you take a couple $100 worth of supplements every month, and I'm not drinking enough water. Like that's just stupid. There's not a nicer way for me to say that for myself. Like, so I'm like constantly making a concerted effort to try and like make sure like drink enough. Like taking the supplement isn't going to help me if I don't drink enough water.
Right.
So those kind of things, and it's kind of like, and it is. It's poor choices with poor sleep. Like, a lot of my closer friends know, like, one of my weaknesses is Cheetos, which I rarely ever eat. But when I was in residency, if I was up in the middle of the night, you could guarantee I had coffee and Cheetos in the middle of the night. Like, I just did.
Yep.
And it's a very random thing for me now, but occasionally.
Yeah, we all have our thing.
Yeah, fatigue, stress get the best of me.
Yeah, but it got you through.
It did.
It served its purpose at the time.
But who knows,
to what effect.
To what effect, yeah. Like, how has that played a role in anything I paid for now? So,
and then just specific to Alaska, what do they say? If there's another natural disaster and no planes or trucks or boats can come in, they'd be run out of food in like 3 days or something crazy. I mean, it's just something that's just ridiculous. And, you know, I really try and support our local farmers, and especially the ones that have an organic food source. But the thing is up here, we have very new soil. The soil has not gone through as many generations of, you know, fall, winter, spring, and the natural decomposition processes. So our soil doesn't have a ton of nutrients in it. So yeah, we can grow a 900-pound pumpkin, which is, that's fine, you know, but so it's not that we can't grow food, it's just like it may not be as nutrient dense as we think. So, and then of course we talked about the daylight challenges earlier. It's challenging to get fat soluble vitamins when you don't eat fat sources.
Right.
There's certainly been trends in, you know, high fat, low fat throughout the years. Magnesium, nationwide, our soil we have a major magnesium deficiency problem in our country, in all of our soils. Up here in particular, there's a ton of iron. I would imagine that you don't see a ton of people with an iron deficiency. It's possible.
Still some, probably mostly reproductive age women, which is not uncommon.
Right. So, but we know from up here, you know, I buy local hay for my horses, and horses up here, when I get their blood work done, because I get their blood work done more often than I do mine, but you know, they have extremely high levels of iron, and then for hoof health, those trace minerals like copper, manganese, even magnesium, they need that for their hoof. So I have to supplement. I find a supplement without iron, number one, and number two, make sure that they get those trace minerals in for their hoof health. And so if you ever want to see, like, there's really cool mineral wheels online, how you can, like, okay, iron blocks the absorption of this. It's like, you know, or what's an agonist or what's an antagonist?
Copper and zinc are.
Yep, copper and zinc.
They competitively inhibit. So.
Yeah, so that's something to try and balance too, which is kind of fun. I already talked about our school lunches and breakfast as well. It's just a lot of processed food, and I'll be honest. I mean, nutrition services here in Matsu, they're really trying. They're really trying to get more nutrient-dense foods out there. So
part of the problem with people that I've known that have worked for early childhood, I can't think of the name of that school program for that right now, but basically Head Start. Yeah. And so it's interesting, and I think even I haven't really talked to anybody specifically at Nutrition Services, but really the government guidelines, you know, they have to go by what are the government guidelines. Our bigger problem is the government guidelines are terrible. Hence, for the average person just seeking a dietitian, or, you know, it's like when I send somebody with diabetes to a diabetes educator, they're still like telling them to eat 12 servings of grains.
6 to 12,
you know, I'm like, no. You know, so, I mean, part of the problem, like, I mean, I think we have, I think Nutrition Services has really tried to really, like, bring local things, do that kind of stuff, but we're really a bit hand-tied by government regulation, and the fact that the government regulation is, you know, and that's so convoluted as to where those regulations come from. It's the dairy industry, and it's probably the drug companies and all of these things that, you know, it's unfortunately it's not about creating health. Unfortunately.
Yep. And so the big question, I think, too, that comes up for everybody is like, well, you know, what should I be eating? What is a natural diet for me and my cultural heritage and my genetics, and, you know, where I've come from? And so that's a really good question. And the answer, of course, is that it's different for everybody. You know, what Alaska Natives have thrived on would probably not be an appropriate diet for somebody who descends from Poland. You know, it's just different. We have different needs, nutritional needs. And so, that part fascinates me. So here's some of my recommendations, obviously, and a lot of these are just common sense things that we need to do. You know, try and eat in a parasympathetic state. You know, we eat on the run. You know, I'm busy, you're busy. Do you get a lunch here? I mean,
I usually eat here.
Right on the desk. Right on the desk. Like in your mind.
Rest and digest.
But a lot of us eat and we're like, oh, I'm gonna answer all my emails at lunch. Well, you're not focusing on what you're chewing, you know, and like, you're probably gonna overeat if you're engaged in something else. Like, it really, it truly is like, put the phone down, turn off the screen, and sit and eat your food. I personally, for me, like eating more healthy fats, it keeps me satiated, it keeps me energized. If you have an unhealthy gut, work with your provider on trying to get that healed so that you can absorb all these nutrients that you're trying to consume. Sleep. I'm just so bad at sleep. Sleep and water. Those are my two things.
Yeah.
Those are my two things that I need to work on. Just get outside and just, stay hydrated and do something fun.
Mm-hmm.
I say avoid sugar just because I think in our country, we just have way too much hidden sugar in our foods. And so, I'm such a label reader. It's like, is there added sugar in this? And
Right.
I'm really trying to avoid that. And I know you were going to talk about
sugar. I'm
going
to put something together about sugar just because I've learned some new underlying physiology behind that. That's kind of like rocked my boat a little bit.
Yeah.
Which is cool and good to know.
Mm-hmm.
But yeah, look forward to that.
But I do like this quote because it's so true. It's like it's either medicine or poison.
Right.
And that's where we're at. It's to me, it's that black and white.
Yeah.
It really is.
Absolutely.
So I think that's me. Yeah.
All right.
So
let's get back and see if we can where is my, let's go back to our screen. Maybe we can, let's go. What did I just do? You can see, let's see. Oh, here we go. Pause share. Stop share. There we go. Now we're back here. So hopefully, it looks like maybe just a couple of you guys, like, are there any questions or anything else we need to kind of address? Laura and I will hang out and rehash the first 15 minutes of our talk, I guess. Hopefully that's helpful. I don't know, I guess that's it. So thank you guys for hanging with us for a little while here.
Can you hear me?
Yeah.
Oh, I wanted to thank you for all this. It's stuff that I feel like I already know, but it's good to go over it again and remind myself, yeah, right. This is why I'm doing this, and I get the Cheetos thing. We like to eat the bad stuff, but
right.
But stay away from it.
Right.
And know it's not good.
Right, and I think that's what makes us human, though, too. Like, I think a lot of times people are like, "Oh, you do everything right," and I'm like, I try to most of the time, but I'm just as human as everybody else. And thanks for that feedback, because that's really helpful. Because Laura and I kind of talked a little bit, even with the talk that I gave a little over a week ago on nutrition. And once I went to give it, I was like, "Oh my gosh, this is really basic." But I was like, you know what? That's probably okay, because we can all rehash that and then dive deeper into different things. And yeah, I think that's something that Laura and I were just talking about doing. We could dive deeper into like some specific things, anxiety, depression, and really just record some things that would give a little bit more depth to each of those things.
Right, because I've been doing this for 5-7 years now.
Right.
All the sort of things you're saying with the diet and the healing your gut and all that, but it's very helpful to just remember why.
Right. Well, good. Thank you.
Yeah, thank you.
Helpful.
Whoops. Yeah, I didn't have any questions. I think it was a great presentation. Like she said, it's a good reminder.
Cool. Thank you.
Mm-hmm.
Well, cool. Well, you guys go have a good day. Laura and I'll re-record the front of the first part of it.
Okay, I'll look for it on your vlog.
Yeah, on YouTube. And you know what I'll do is I'll actually send it. Before the end of the weekend, I'll have it out again in the newsletter and say, hey, if you missed the talk, here it is.
Great.
I have a question.
I'll throw a link in there.
Somewhere down in the future, maybe talk about supplementation, because people tend to over-supplement.
Yeah.
Maybe that's not, I keep adding little things on, then I take things out, and who knows whether it's helping, but, whether I'm just throwing money away. So that would be a good one for me too.
I totally agree, because it is,
That's an
We
industry.
do a
and
lot. It
it's
is
another
an industry, you
too.
know, and like that's why I kind of laugh at myself. I'm like some months when I like don't drink any water. I'm like, oh my God, like I spent $150 on supplements and I'm not like hydrated. Like,
Right.
why am I supplementing if I'm not hydrating?
Well, yeah. So I have those down the road somewhere where you throw that in, maybe.
Yeah.
Yeah, I agree. That would be very helpful because I do a lot of supplements too.
Right.
Yeah, it gets expensive, and then I go, do I really need this? So then I take it out, but I can't tell, and I don't want to, how you say it, have one thing contradict another. You know, like
Right.
recently I had a cold, so I was overdoing the zinc. Lord knows what that did to my body.
Short term, it won't hurt you. But you know, that would be a way to. I mean, I'll think about how we could do something like that. I mean, clearly that has to be very individualized, I think.
Right.
But I think there are basic tenets for all of us. I think that probably be really helpful.
Okay. Thanks.
Cool.
All right. It was good.
All right.
Appreciate
Thank you.
Thank you.
Have a nice night.
All right. I better mute.
All right. Thank you. Let's see. I don't know that I can. Gosh, I gotta remember that next time.
Visit resuming,
It's gonna.
not starting a new one.
We're resuming the recording. So we'll just go back to. There we go. So let's get to from the